It looks fine. You look good. Have fun.
All right, I've turned it on here. All right, good morning, everybody. Welcome to the second talk in our speaker series for this academic year. So we're very pleased this morning to welcome Dr. Alistair Fraser from the University of Glasgow. So Dr. Fraser is a senior lecturer in criminology and sociology at the University of Glasgow and director of the Scottish Centre for Crime and Justice Research. He teaches and researches issues of youth violence, street culture, and urban crime, with a particular interest in the global gang phenomenon, and is particularly interested in ethnographic, creative, and interdisciplinary ways of working. His work seeks to make theoretically ambitious, empirically grounded, policy-relevant contributions to academic and public debate. He's currently leading a new study funded by the Economic and Social Research Council UK in investigating the meaning and utility of public health approaches to violence reduction in Scotland and England. And I will turn it over to you, Dr. Fraser.
Thanks very much, Jeff. And thank you for the invitation, especially thank you to Sandra for inviting me along today. And it's a pleasure to be with you. It's 5 o'clock in the evening here in Scotland. There's still a little bit of light in the sky, but it's starting to wane. I can smell a little waft of fireworks and bonfire on the wind as we're entering into that kind of witchy period of the year. And thank you also for accommodating my request to shift the time. I'm aware that this is not perhaps as ideal a time from your end, but yeah, the time period for me is of 6:30 to 7:30, which proved too challenging. So I'm very grateful for that. And also, I suppose it's worth saying that it is one of the kind of strange and rare silver linings of the pandemic and the lockdowns that have been brought on by it, that we are connected in this way. There was a time when Zoom was a word that kids used to describe the racing cars rather than a verb to describe global connectivity. I was just sharing with Jeff and Sandra there the fact that I was involved in a seminar just a few hours ago with colleagues in Australia. So the pandemic has opened up these kind of magic little windows of shared time and space in the international academic community that didn't exist before. So that is worth commenting on. And I suppose as well, because we run events like this ourselves, and what I like best about this is the technology affords a kind of slightly more actually informal tone than perhaps the traditional academic seminar environment. There is a slight degree of informality, of chat, of kind of personal relationality that you get through these mechanisms that we perhaps don't in more formal settings. So with that in mind, I'm going to be sharing with you today something relatively informal, and that is a work in progress or a set of ideas in progress. Jeff mentioned that I'm leading this new project for the ESRC with colleagues, and that's really what I'm going to be sharing with you today. Some of the conceptual, methodological issues that we're working with on the project at this point. So I'm just going to share the screen now. You can hopefully see my slides. Okay, here we go. So hopefully you can all see that now. Yes, so so the talk is entitled "The Violence Revolution?" ? And that is intended to be in some ways provocative. It refers to or adduces a purported revolution in approaches to violence and violence reduction that emanates from these shores, from the city of Glasgow and the country of Scotland, where we have seen a reduction of violence by more than 50% over the last 15 years, and particularly a reduction in violence between and amongst young people and young people involved in gangs, which much of my work to date has been on. And the project that I'm setting out on is trying to interrogate how, why, and under what circumstances that violence reduction occurred. And we're looking at that, or I'm looking at that through the lens of policy mobility, and the public health approach to violence reduction. And more of that to follow. I should say from the outset too that I'm not alone in this endeavour. There are other fantastic colleagues involved in these studies and discussions that I must mention. First and foremost, Keir Irwin-Rogers and Luke Bellingham at the Open University, Fern Gillen here at the University of Glasgow, Susan McVie at the University of Edinburgh, and Tim Newburn at the London School of Economics. Together we are this Public Health, Youth and Violence Reduction, or FIVER, team. And it's a 3-year project, and we're just nearing the end of year 1. So the issue of violence between and among young people is one of the most complex and intractable in public life. The World Health Organization estimate that some 43% of global homicides involve people aged between 10 and 29, with many more affected by non-lethal forms of violence. And now these figures may seem abstract and impossibly large, but I always think it's important to recognise when we're talking about violence, the human cost, as well as the economic and social cost. We're not only talking about the loss of life, of injury, of lethal forms of violence, we're also talking about trauma, loss and bereavement amongst families and amongst communities and societies more broadly. We're talking about the economic costs to health systems and the economic and social costs of incarceration. So when we're talking about this huge global phenomenon referred to as violence, we're talking about almost an incalculable impact around the world. And so I hope that the goal of the project, which is to better understand violence reduction, that is, means to intervene in or mitigate the most egregious impacts of violence, can be thought of as something of a shared public good. And I hope also, and yeah, I suppose that word is significant, I hope, because the story of Scotland, the story of violence reduction, is in many respects a qualified success. And criminologists tend to be not the most hopeful of scholars. I think that's fair to say. It has been characterised as a somewhat dismal discipline when people spend their lives and work looking at issues of crime, criminality, victimisation, punishment, incarceration, inequality, and we see the most swinging effects of inequality writ large in the social fabric. It's difficult to remain hopeful, but as the Scottish musician Roddy Womble once said, hope is important. And I think there is some seed of hope to be gleaned from the Scottish story that I hope that we're able to kind of cradle and add fuel to through the course of this study. So I'll say a little bit about the kind of Scottish story by way of context before moving on to the study itself. So 15, 16 years ago, Glasgow was best known, I think it's fair to say, in the public eye, in the cultural imagination, as a city of violence, a so-called no mean city. I remember going to, when I moved down to England, and told somebody there when I met them first that I'd moved there from Glasgow. They said, we lock our doors in Glasgow. She had been on a family holiday in the north of Scotland, was driving back to Glasgow on the motorway, and her father insisted that they lock all the doors driving through the city. Obviously imagining that kind of the violent city, this kind of lumbering mass of Glaswegians pawing at the sanctity of the family vehicle. That was a well-established trope in the public domain. And it was justified in some ways. The United Nations and World Health Organizations carried out empirical works on violence around the world and found Glasgow to be one of the most violent cities in the developed world. And much of that was driven by territorial gang rivalries amongst young groups of mostly men engaged in territorial battles over neighbourhood lines. And that was indeed what prompted my own research. So I worked for several years as a youth worker and academic researcher, as well as a police analyst in the city of Glasgow, trying to understand how and why and under what circumstances young people got involved in territorial gangs and how that violence could be understood and what it meant to them. So I spent a long time studying that and then wrote a book about 100 years of gang history in Glasgow, about it as a hand-me-down identity, was passed on from generation to generation, understanding it in the context of the political, social, cultural fabric of the city. But then moved to work in Hong Kong for 4 years and came back again. And lo and behold, the story of Glasgow had changed. It was no longer the city of gangs or the violent city, but suddenly the city of violence reduction, the city where violence had more than halved and gang rivalries had seemingly dissolved. And all of a sudden, that was the story that we heard about Glasgow. And it's a story that has spread far and wide through film, TV, and the popular media. And much of this story revolves around a particular grouping within the then Strathclyde Police called the Violence Reduction Unit. That was a group set up in the aftermath of these endemic rates of violence that was set up specifically to try to intervene and reduce that particular form of violence between and among young people. And in its first iteration, it was set up by 4 people at the behest of the then Chief Constable Sir Willie Ray, one detective chief superintendent, John Carnahan, a principal analyst, Karen McCluskey, a researcher, Will Linden, and another police officer called Alan Woods. And between the 4 of them, they set up shop in a kind of small windowless room in police headquarters and set about what they came to refer to as a public health approach to violence reduction in Scotland. And that was drawing together the best evidence that they could, the best data they could, and trying out different methods of engaging with young people. And they tried a lot of things. They experimented. Some things went well, some things not so well. But they, over time, developed a very significant public profile. And when the story of violence reduction in Scotland is now told, it's really as a cause and effect of the introduction of the Violence Reduction Unit and the reduction in violence. And indeed, it's this story has resulted in a significant instance of policy mobility or policy transfer, whereby violence reduction units based explicitly on the Glasgow model have been set up across England and Wales. So now £35 million has been poured in to set up 18 more of these units based on that same model as was the case in Glasgow. Okay, and yeah, I'm maybe skipping ahead a little bit here, but just to kind of foreshadow, the kicker is that despite this hugely successful model, apparently, there is the evidence base for what the actual evidence-based explanations of violence reduction in Scotland are somewhat shaky. It has been said that the VRU were very good at doing, but less good at evaluating. So there is less clarity about what it was that they did that was useful or successful than is popularly believed. So it feels like perhaps the development of policy, as is not uncommonly the case, has outstripped and outpaced the evidence. So violence reduction units are being set up across England and Wales, but without a clear sense of what it is about what the Scottish one did that was useful and successful. So that's kind of one of the premises for the study. So I'll maybe just go into that a little bit more detail now. So of course, it's worth mentioning, what is the public health approach to violence reduction? It's not a new idea. The first record that I've come across was in the US Surgeon General's report on violence in 1985, which suggested a public health approach for the first time. So that's been around for a long time. It's one that's been subsequently adopted by the World Health Organization that seeks out risk factor interventions at primary, secondary, tertiary, and societal levels. It seeks very often to shift the terms of conversation about violence away from police, justice, and the courts as the sole arbiter, and towards a more broad-based, multifaceted, multi-organizational response involving partners in education, health, social care, welfare, and so on. And proceeds through a kind of a data-driven, evidence-based response. And this is broadly what the VRU in Scotland was attempting in its way in those early iterations. So just to round out some of those broad points that I made at the outset. So this was in 2005, those early reports of Scotland as a particularly violent country, and Glasgow as a particularly violent city, with the highest murder rate in Europe, the most violent country in the developed world. And we see the politicians and policy communities seeking to rally around this and find a means of intervention. And then subsequently, you see the reduction from 2005 down to 2015, over a 10-year period, a very clear decline. Important to note that it hasn't been, it has not continued. So in the last few years, rates of violence have started to increase again. And if there does happen to be anyone joining from Scotland or the UK, you might be aware that there was a recent homicide involving a young person that is purported to be gang related. So that there is a sense that perhaps it's been re-emerging in recent weeks and months. But so these previous slides were prepared by my colleague Susan McVie, and she summarises here some of the evidence based on data on the causes and consequences of changing violence in Scotland. And her analysis suggests that the reduction is largely to do with a reduction in young men fighting with knives in public places. So the territorial gang phenomenon that I researched for many years, there has been a real dissipation of that. And while that's a really important success story, Susan is keen to stress that this is not a universal picture, that there has been far less of a reduction in domestic related violence, that there is no reduction in repeat victimisation in relation to violence, and that although the prevalence in most Scottish communities of violence has reduced, there's been no change in some of the most deprived communities. So that it's not a straightforward picture. And Susan is also keen to stress that there are a range of explanations that can be offered that don't relate directly to intervention by the Violence Reduction Unit or police. And there are questions like violence reduction that has been seen elsewhere in countries like Sweden, where there was no comparable policies being drawn on. There are kind of broader social transformations that have been at play in Scottish culture, particularly among young people. So you have fewer young people spending time in public spaces, on the streets, more technologically connected, more time spent indoors. So these are all some kind of contextual, social and cultural factors that may be implicated here. And the VRU and the police, of course, would be keen to stress that there was a stringent adoption of stop and search or stop and frisk policies that went alongside the VRU's measures, so that they would want to say that had a role in the reduction of gang violence in Scotland. So that's kind of the best evidence that we have available about the explanations of violence. The basic fact is the success story of the Violence Reduction Unit, as it's told and retold, is not currently one that's borne out by the empirical evidence base, and that's really what we're trying to provide in part with this study. So, how are we doing for time? Yeah. So, in the kind of second half here, I'm going to shift gears and talk more directly about the project itself, and I'll talk through a few different components. Firstly, I'm going to set out a few of the concepts that we're working with. Policy mobility, relationality and territoriality, and social transformation. These are some conceptual or theoretical efforts to understand violence reduction in Scotland and where the VRU is situated within that. And then crucially, how that policy transfer or policy mobility is operating between Scotland and England. So the extent to which what is happening in London in particular, that's where our main field site is in England, to the extent to which there are kind of parallel set of social and cultural and political kind of conditions that allow the development of VRUs in both places. And then a kind of comparative analysis of the different patternings of Scottish and London governance as a way of understanding how, why, and under what circumstances these policies can travel and take root in different places. So I should say that this slide was prepared by my colleague Tim Newburn for another talk that we gave recently. And he is the one on the team that I think has written most extensively about the policy mobilities literature in criminology. But a few points bear mention. So policy mobility or policy mobilities is a large and growing area of study. I think drawing together threads from human geography, anthropology, and the sociology of mobilities that really tries to understand the way that social policy and public policy moves and flows from place to place. So the terminology has shifted from diffusion, that is kind of making its way out incrementally into the firmament, to direct transfer from place to place between specific policy actors, to now this more kind of fluid, mutable, contingent idea of policy mobilities. And this is that drawing on the broader mobilities paradigm, where people like Mimi Scheller and John Ury have written about, that understands the increasingly networked and connected nature of social life, and the fluidity through which ideas, people, culture, technologies switch and flow between places in often disparate contexts. Building out from that, and I suppose the work of people like George Marcus and the ethnography of the world system, trying to follow ideas and policies as they move across concrete space-times. So this literature is become increasingly common in the social sciences, but so far relatively marginal in criminology. And so that's something that we're trying to address. But where policy change has been discussed in crime control or penal policy to date, it's not so much about that fluid, ephemeral contingencies of catching ideas in motion like butterflies stuck in sap, but rather about the slowness in some ways or arcaneness of criminal justice systems and bureaucracies, and the difficulties in some senses of instituting policy change. So there is a kind of interesting tension to explore between the policy mobilities literature, which looks at liquidity and flow, and perhaps the more established policy transfer literature in criminology, which looks at slow development and windows of opportunity that open up. And these are very much the kind of tensions that we're keen to explore. So that tension, I think, is captured quite powerfully in the policy mobilities literature by this dyad of the relational and the territorial. So which I think of as being something like Manuel Castell's notion of the space of flow and the space of place. So the relational and the territorial in relation to policy mobility is about, on one hand, the way that policy ideas kind of encircle and envelop policy actors' assumptive worlds. This is conference spaces, workshops, social media, policy learning tours, visiting so-called starchitects or policy entrepreneurs that have a particular agenda to pursue. These are the kinds of placeless flows of ideas where policy actors interact with one another and ideas move from place to place. And the territorial being the more kind of concrete space-time, often nation-state or city-level bureaucratic governance, through which these ideas must kind of flow and channel and kind of be articulated by. So this is the idea of looking at, for instance, for this, the different patterning of the institutions of government and governance in Scotland compared to London, and trying to use the cities of Glasgow and London as a lens through which to understand how these ideas kind of attach and become sticky and make sense in particular places and times. And so we're trying to investigate that at a number of different layers. So looking at reconstructing policy change narratives within government actors, so try to understand the kind of the processes and mechanisms through which these ideas took root and became articulated within those quarters. Secondly, through the way that those ideas are filtered and were articulated at the level of practice, so concepts level bureaucracy where policies and kind of practice come into relation. And thirdly, at the level of narrative, at the level of storytelling in particular, this is something that we've been picking up already in the interviews today, is the significance of both the large success story of Scotland and the Violence Reduction Unit, and the smaller success stories that were articulated by the kind of charismatic voices that were part of that debate about change, about lived experience, about hopefulness. So we're trying to kind of piece this together across multiple levels. The third thing that I wanted to touch on, if anyone is familiar with my work, you will know that I frequently reach for the social theory of Pierre Bourdieu to make sense of any given kind of social structural problem. So I've been reading recently this sizable volume that he produced on the artist Manet, which looks at not economic, social, or political revolutions, but symbolic revolutions, the way that changes can occur within designated field contexts, and how change happens. And in the case of Manet, it was Bourdieu positions as a charismatic prophet, someone that's trained within the mechanisms of the dominant class, but then rebels against it and is able to bend the field through their mastery of it, and then thereby exposing the field doxa, so they kind of making visible the taken for granted assumptions within a given context, so flipping both cognitive and in some cases social structures. So this is obviously very sketchy at this point, but these are the kinds of ideas that I'm working with. So he says, as well as having a role of prophets, he's also interested in the way that external events can expose those doxic relations and the significance of forming coalitions of social or symbolic struggle across what he calls the dominated fraction of the dominant class. So people that are teachers, health professionals, unpromoted academics. That is literally what he refers to, like creating a social movement that seeks to change the dogma of a given field context. So I'm not saying this is what's happened in Scotland, but this is the kinds of things that I'm trying to work with. Okay, so from the more abstract to the prosaic. So in the last 5 minutes or so, I'll just talk you through some of the research questions that we are pursuing and the methods that we're going to be drawing on. So we can cluster these research questions in three kind of clusters. The first two being, what are the factors that contributed to the reduction in youth violence in Scotland, and to what extent can these claims be substantiated by evidence? So that is the kind of Scottish part of the study that we're actively engaged in now. Then secondly, policy travels looks at how the public health approach is developing in London, what factors are promoting or impeding change at the level of policy, practice and community. And then the final cluster of questions are trying to bring those two sets of evidence and data into dialogue with one another, and hopefully be mobilised for the purposes of establishing best practice and informing debate more broadly. So I'll just talk you through some of the methods that we're using. So the first set of questions, if you recall, which are about the causes of violence reduction in Scotland and whether they can be substantiated, how public health approaches are developing in London, and what's impeding or allowing these to unfold. So we are firstly doing a series of interviews, and in Scotland we're now completed 20 of these interviews, and that's trying to draw on the methodology of policy mobilities published by Astrid Wood, which is about policy reconstruction. So we're interviewing civil servants, politicians, journalists, community activists, police officers, violence reduction unit leaders, as well as community voices, to try to compose as best we can a timeline of events that through which the public health approach to violence reduction emerged in Scotland, and through which the work of the VRU developed. And we're purposefully seeking out a broad range of explanations that involve the violence reduction unit, but involve a much broader range of social and political forces at play. And then the second tier of that is to draw on the best available secondary data to ask some of those questions. So, for instance, one of the primary explanations that has come out of interviews so far has been the parallel change that has happened in the education system in Scotland to reduce school exclusions to almost zero. So we're trying to map that school exclusion data against violence data and try to understand whether that claim can be substantiated. It's important to say to you here that we're trying to work on kind of two parallel timelines about the development of the violence reduction unit in Scotland in the early part of the 21st century, and the development of violence reduction units in England and Wales more recently. And all of that is designed to inform the kind of, I suppose, one of the primary contributions empirically of the study, which is a multi-sited ethnography. And that's what we're aiming to move into in the next 12 months. And that's hopefully something that I can get some discussion going in this forum. And because these are still, as I say, ideas in motion, and we're still kind of working out exactly the specificities of how, where, and when we're going to carry out this work. But the idea, in short, is to use that idea from George Marcus, to follow the policy, to try to understand the way that certain ideas move and cross-cut between policy circles, and then in turn, how they attach into real lived community contexts. So we'll be looking to carry out ethnographic observation in the assumptive worlds of policymakers, that is through attending meetings and events in relation to violence reduction and public health approaches across the UK, to understand the way that these debates are unfolding and the discourse is being set up. And then simultaneously be carrying out work, similarly observational work, in what we would call the interface zones between policy and practice. That is where the rubber meets the road, of where the ideas are translated into everyday practices and policies by people in discretionary situations, like the street level bureaucrat idea that I mentioned earlier on. But at the same time, though, we're wanting to open those questions up, because although violence between and among young people has reduced, we're also interested in a broader definition of violence. Bourdieu elsewhere talks about the law of violence in the publication Acts of Violence. He talks about the symbolic and structural violence of economic inequality and its relationship not only to interpersonal violence, but to issues of addiction, suicide, and social harm. And although in some contexts youth violence has reduced, in Scotland also drug deaths have become famously a huge issue. So we're interested in not only understanding how that particular form of violence has reduced, but also perhaps how that might have evolved and changed over time. Okay, we're nearly at half an hour, and I think you've probably heard enough of me droning on at this point. I don't have any conclusions at this point because these are, as I said, are ideas in motion and works in progress, but I look forward very much to your own comments and reflections. If you do want to follow the story of the research, you can join by following our Twitter feed or the website listed on the slide here. And yeah, and hopefully we will be able to capture that little message of hope that I mentioned at the very start. So thank you all very much.
All right, thanks, Dr. Fraser, for that awesome talk. Okay, so we'll just give Dr. Fraser 2 seconds to catch his breath here. So if anybody wants to ask any questions, Sandra has posted in the chat that grad students get to go first. So do feel free if you want to just ask the question, put up your hand and I'll ask you to turn on your mic in a sec. If you don't want to appear on camera on the YouTube stream, just type it into the chat and I will read it out. And if you're on YouTube and watching us, do type in the chat and I will convey the questions over to Dr. Fraser here. While he, catches his breath for a second, I do want to say that our next talk is, at the end of November on November 26th. And we have another really exciting one. Dr. Martin Bouchard from Simon Fraser University is going to be giving a talk called 5 Lessons Learned from Research on Prison Networks. And again, that is going to be available on our YouTube channel. So keep an eye on the YouTube channel and on all of our social media. So on Twitter, on Instagram, and on Facebook. We are in all 3 places, and you can find the links on our website, CanadianCriminology.com. All right. So, you've shared the links. All right. Does anybody have any questions for Dr. Fraser? Again, grad students, you have to go first. Oh, who has a hand up? I got Dan Jones. I'm just gonna see if all right, Dan, since no grad students have volunteered, go ahead with your question.
I'm gonna go with it. I am a grad student because I'm still doing my PhD at the University of Huddersfield, so I took that opportunity to jump on that. So my question is just to really, I got a couple of questions, but my first question is, you talked about stop and frisk being, a positive impact on the violence in Glasgow. What and how did the police address the issues around stop and frisk with, overrepresentation in BIPOC communities and those types of things as the counter argument? Because that's really been something you've seen policy change on and stop in the vast majority of North American police services.
Thank you, Dan. That's a really good question. And I did realize as I said that I was passing over it a little bit too smoothly because it's far from a smooth or straightforward topic. Well, I think I did say, or I was careful to parse it as the police would say, that the stop and search, as it's called here, policy played a role. I'm not sure I would agree with that, or if others indeed would. But just to give a little bit of context here, so during about the period 2008 to 2010, so at the time that the Violence Reduction Unit was trialling a model of the Community Initiative to Reduce Violence, similar to what was used in Boston and Cincinnati. There was at the same time a more kind of traditional hardline policing of gangs, frankly, and that stop and search was a really central part of that. And a colleague of mine, a PhD student at the University of Edinburgh, was studying this phenomenon as it unfolded, asking for police data on stop and search, and found basically that the use of stop and search over this time frame had increased by something like 1,600%. So all of a sudden, communities were being absolutely flooded with police officers, and young people were being stopped and searched 10 times a month. Her findings were shocking and astonishing when they were published. And it was not people of colour. I mean, Scotland is a much more kind of mono-ethnic culture than in North America, for example, but that is changing. But it was a lot of white working class young men that were being stopped and searched on a regular basis. So it had that obviously class dimension, if not the racialized dimension that we've seen elsewhere. And it was roundly criticised as a direct result of that research, and in fact has almost been completely done away with as a result of that, as a result of those findings. Is a longer and more complicated story than that, one that's almost worthy of a Hollywood film. What was going on behind the scenes, but stop and search has been largely discredited in Scotland. But nonetheless, when you interview police officers now about violence reduction, they will say that's an explanation for it, and that will be, of course, one of the things that we look to substantiate or otherwise.
Thanks very much.
All right,
Catherine.
perfect. Oh yeah, Catherine, go ahead. All right, I can just read Catherine's question because she had it in the chat. She said, go ahead, Catherine.
I was just unmuting. I'm sorry. So my question is just kind of more generally, I suppose, but as public health approaches have been really gaining traction across, I guess, internationally, because we're seeing that in Canada as well. One perceived requirement that I keep kind of hearing being brought up in research, but also as like a crime analyst previously, is that there's this expectation that we need to share information between the different practitioners or sectors involved in these solutions. So I'm just wondering what your thoughts are on information sharing and the different risks and benefits that could arise by increasing data and kind of information that's transferred across agencies, particularly, I guess my interest is when the police are involved too.
Thanks, Catherine. That's a really, really important question. And I mean, I should have said as well, this study is not solely a kind of scholarly and academic endeavour. That we are working closely with both the violence reduction units as well as the police in Scotland and the Metropolitan Police, with the Home Office and the Scottish Government and other community level partners who are actively involved in trying to reduce violence at policy or practice level. So what we're trying to do is be useful as well as asking these broader theoretical questions that I've offered. And also it's important to note that we're trying as much as possible to do that in real time. So rather than spending 3 years gathering data and then 3 years analysing it, maybe then another 3 years writing a book about it, and then coming back in 10 years' time saying, lo and behold, look what we found. We're trying to form those kind of trusting, connected partnerships with people involved and invested in these questions as we go along, and where necessary for us to get out of the way and to create practice-based connections between Scotland and England that perhaps didn't exist before. So that is important to stress that. Your question though was more about information sharing, and I suppose I would probably add data sharing. So in this country, we now have a very robust legal response called GDPR, which is about, it comes from the EU, but about data sharing and privacy legislation. And it is an increasingly high bar to share data between partner organisations, but it is also really important if we're trying to introduce public health approaches and multi-agency mechanisms through which to deliver these. It's important, or more than important, it's absolutely necessary for there to be a facility to share information between them. I don't know in practical terms what the response has been like to GDPR within these multi-organisational teams. I know there's been some successes in violence reduction units in England about finding ways to share data between organisations, but yeah, that is certainly something that's of significance. I don't know if that answers your question sufficiently.
No, that's fantastic. And it's kind of similar thoughts I think we're having here locally too. So I appreciate it. Thank you.
All right, so I think the next question comes from, I'm sorry, I'm probably mispronouncing this, but Zhao. And so it's, how well do judges, prosecutors, lawyers, and legal authorities receive and operate within these policies?
Oh yeah, here we go. How well do judges, prosecutors, lawyers, and legal authority receive and operate within these policies? Yeah, that's a good question. So I can't speak to that question in its totality. I guess I can speak to two particular issues. One is that in its early days, the Violence Reduction Unit worked with the Lord Advocate to issue new sentencing guidelines pertaining to knife carrying. And at the time, it was thought that that they should be made more punitive to send a clear message to those that carried knives. And the people that were involved in that would say now that there were some parts of that were really significant. So they started from that legislation, DNA testing anyone who was caught carrying a knife, and that led in one particular case to catching someone that was responsible for a murder that would otherwise not have been captured. So there were some successes as they would see it from that point of view. But I'd say of the kind of cross-sectoral responses to public health and violence reduction, the law is probably one of the areas that has been least touched by that. Although in recent years, we have seen an increased calls for trauma-informed legal practice. So that is lawyers that are trained in trauma, and to recognise the presentational features of this experiences of trauma amongst their clients, and that very much is in keeping with public health approaches.
Yeah, I think we've got Rebecca, then Justin, and then Holly. So did you want to ask your question, Rebecca?
Yeah. Thank you again. This is really good. So my question is, so you mentioned that the ethnographic policy research would incorporate voices of law enforcement, of policy writers, and of other agencies. And then you also said that it would include community voices. And I was just wondering if you could say a little bit more who those community voices are, and then also whether it would be within the scope of your policy research to actually see the impact on those at-risk youth that might actually be perpetrators of violence at some point.
Thanks, Rebecca. That's a really terrific question, and that's actually one of the questions that one of the reviewers for the original proposal asked. So that is very astute, and it's a funny one because all of my work to date has been at a community level. So like the sort of policy and practice levels that we're moving into, and these elite interviews is uncharted territories for me. So it is the kind of at the community or street level that in some ways I feel most comfortable. So like that is something that's very important for this study. But we've not, I think, quite figured out the way to parse that quite yet. So we've been in our interview stage, we've been carrying out interviews with people who run youth charities in areas of multiple deprivation and communities affected directly by violence, to ask like to what extent they can discern these changes that we see in the statistics at a local level, so at a level of lived experience. Like, can you see a reduction in gang violence, or has it evolved into different areas? So these are specific questions that we're asking. But that is what we do with that is still somewhat open to development. So the community case studies or the ethnographic work that we intend to do is both looking at the impact of policies and what is actually happening at a community level, and whether these two things can be discussed in relation to one another. And of course, like, young people's voices are probably the most important amongst that. We're working currently with an approach, or my colleague Fern is currently developing an approach of co-production, creative co-production with local young people to generate their own experiences of violence and community life to inform the study. Yeah, but that's still very much in development.
Thank you.
Yeah, Justin, go ahead.
Hey, thanks so much for your talk. It's a super interesting topic. I just had a question about if what's been going on in the US with Black Lives Matter, the defund the police kind of narrative. I'm wondering if how much that discourse may or may not have impacted violence reduction strategy or thinking or discourse in what you've seen.
Yeah, great question. I wish in some ways that my London-based colleagues were here to answer that, because I think those debates are much more live in the context of London and in terms of stop and search, defund the police, and Black Lives Matter movements. That I would say that those discussions are perhaps less live in Scotland right now. But sorry, excuse me, I've got the window open. There's a police siren going off, so just give me 2 seconds. Yeah, sorry, I'm not sure that was a very good answer to your question, Justin. But yeah, the fact is that I would probably need to defer to my colleagues who are not present to answer that question more fulsomely.
Okay, yeah, Dr. Compo, if you want to go ahead, and then I have one question from YouTube, and then I think that'll be all the time we have for today.
Okay, yeah, thank you so much. I was really taken by what was a pretty quick reference to the possibly changing nature of youth violence. So not just a quantitative change, but like a qualitative shift to that which is more like reflective of like a structural or a symbolic violence, like an internalized violence. And you mentioned addiction. And so I'm wondering if you can say more about your plans around that, or if there are more plans around that at this point, and how a public health approach can help us study these other axes of violence. I'm just really interested in that because on the other side, I'm right now looking at policing, police violence, and sort of the slow violence against communities of policing. So I was just really taken by that, and I was wondering if you could say more about the project plans for that.
Okay, thank you very much. That's a really wonderful question. I'm going to start my answer with a caveat, which is that we are still in the process of, as I've mentioned, developing how these questions will play out in terms of fieldwork. So that is actually really helpful to think with your question about as we're designing the next part of fieldwork, because this is something that is very much on my mind. When we started out looking at this study, I was very conscious to not compartmentalize violence and to think about structural and symbolic forms of violence. And although the success story amongst young people is maybe a kind of reduction in a public form of violence that perhaps has a secondary effect of reducing fear of crime of people in communities, that perhaps there is a sense in which that more public or external instance of violence has been turned inwards, and we see increased rates of drug-related deaths, addiction, of mental health crises, and suicide. And as I said, Bourdieu talks about the law of the conservation of violence, which is the inequalities thrown up by financial markets. He says are invariably matched by rates of violence like addiction, harm, suicide, and so on. And so that was one of my own kind of senses when we started this project, is not to get too focused on young people, but try to look in the round at what's happening more broadly. And I suppose also to puncture some of those very kind of romanticized stories about Scotland as a land of milk and honey. There some of the reporting about Scotland has that kind of tone. But what I think is probably less clear on at this stage is how that will specifically inform the fieldwork, because these are obviously large and complex questions, and ones that can't be easily approximated through a single study even. But insofar as I think that will enter into the research design, it's by looking at a community level. So we are using data to help select community field sites. And when we enter into those field sites, we'll be looking, on one hand, at some of the policies and practices that have occurred there, but on the other, more broadly, at people's experiences of that community and of experiences of violence broadly defined within that community. So we'll be looking to situate that specific instance of youth violence in those contexts within a broader context of violence and social harm. And that's already coming out from some of the interviews at community level, and drugs and drug use is featured heavily already. I like that notion too, though, of the slow violence of policing, and I guess we can think of other forms of slow violence, of poverty and inequality also. So yeah, that will be something that and maybe that also comes back to Justin's point about the kind of abolitionist movements and social movements against the police. And so we'll be looking carefully at people's views of the police and whether they are part of the problem in some senses, and we're certainly not allied with them in any way.
Thank you so much. I'm really looking forward to learning more about your project, and I may reach out.
Okay, that'd be great. That'd be great, Holly. I'd love to read some of your work as well.
Thanks so much.
Okay, perfect. And we're just about on our hour here, but I got one more question just here from L'Oreal on YouTube, and she says, "Thank you for the talk, Dr. Fraser. Can you speak more to the public reception of violence reduction units in Scotland, i.e., how did the public perceive them? How did the media in Scotland talk about them?"
That's a great question. In the early years of the violence reduction unit, it was a relatively small team. Most of their work was carried out somewhat under the radar, without a huge public or media profile, and I think that was deliberate. They were given the space to try things out and fail and get them wrong, and that meant out of the kind of white heat of the media spotlight, there was space to experiment and get things wrong. And when they did step into the spotlight, they did so armed with some of the success stories that they'd been responsible for during those early years, and were very adept at working with the media. And like they brought editors of all the mainstream news outlets in Scotland together, and were very available to journalists for quotes about violence or stories, and used the media and their platform expertly and charismatically to tell positive stories of change. And my sense is that is part of the story here. That there was a kind of hearts and minds approach of people being won over across multiple different sectors by those stories and by those voices.
All right, wonderful. Thank you so much, Dr. Fraser, and thanks so much for giving us some of your evening, for zooming in from halfway across the world. We really appreciate it. So we will end the stream here, and just another reminder that we're doing, another talk at the end of November on the 26th. Martin Bouchard from Simon Fraser University. So we will hopefully see all of you then. All right, so the live stream is now off. So we're not on streaming on YouTube anymore.